Cryotherapy. Although many technological advances have been made in the realm of therapeutic modalities in the past century, the use of cold remains one of the most effective and least expensive modes of acute injury and pain management. Effects of tissue cooling. Cryotherapy exerts its therapeutic effects by influencing hemodynamic, neuromuscular, and metabolic processes. Hemodynamic effects. Initial decrease in blood flow. Generally, cold applied to the skin causes immediate constriction of the cutaneous vessels and reduces blood flow. This vasoconstriction persists as long as the duration of the cold application is limited to less than 15 to 20 minutes. Cold causes cutaneous vasoconstriction by direct and indirect mechanisms. Applying cold activates cutaneous cold receptors directly by stimulating the contraction of the smooth muscles in blood vessel walls. Cooling the tissue decreases the production and release of vasodilator mediators such as histamine and prostaglandins, resulting in reduced vasodilation, and causes a reflex activation of sympathetic adrenergic neurons, resulting in cutaneous vasoconstriction in the application area. Cold is also thought to reduce the circulatory rate by increasing blood viscosity, thereby increasing resistance to flow. Later increase in blood flow. When cold is applied for longer periods of time or when the tissue temperature reaches less than 10 degrees Celsius or 50 degrees Fahrenheit, vasodilation may occur. This phenomenon is known as cold-induced vasodilation. This effect is most likely to occur in the distal extremities, such as the fingers or toes, with applications of cold at temperatures below 1 degree Celsius for longer than 15 minutes. Neuromuscular effects. Cold has a variety of effects on neuromuscular function, including decreasing nerve conduction velocity, elevating the pain threshold, altering muscle force generation, decreasing spasticity, and facilitating muscle contraction. When nerve temperature is decreased, nerve conduction velocity decreases in proportion to the degree and duration of the temperature change. Cold has the greatest effect on conduction by myelinated and small fibers and the least effect on conduction by unmyelinated and large fibers. Applying cryotherapy can increase the pain threshold and decrease the sensation of pain. Cryotherapy has been associated with both increases and decreases in muscle strength. Isometric muscle strength has been found to increase directly after applying ice massage for 5 minutes or less. In contrast, after cooling for 20 minutes or longer, isometric muscle strength decreases immediately after cooling. This initial reduction in performance may reverse 1 hour later. Decreased spasticity. After more prolonged cooling of 10 to 30 minutes, a temporary decrease in spasticity and clonus, and a reduction in resistance to passive motion can also occur in patients with spasticity. Metabolic effects. Decreased metabolic rate. Cold decreases the rate of all metabolic reactions, including reactions involved in inflammation and healing. Thus, cryotherapy can be used to control acute inflammation, but is not recommended when healing is delayed because it may further impair recovery. Clinical indications for cryotherapy. Cold therapy is widely used in acute musculoskeletal trauma, in pain and muscle spasms, in myofascial pain syndrome, and in some cases of spasticity. The acronym RICE refers to the combined intervention of rest, ice, compression, and elevation in acute trauma. Contraindications and precautions for cryotherapy. Although cryotherapy is a relatively safe intervention, its use is contraindicated in some circumstances, and it should be applied with caution in others. Contraindications. Cold therapy is contraindicated in cold hypersensitivity, cold-induced urticaria, cold intolerance, cryoglobulinemia, paroxysmal cold hemoglobinuria, Raynaud disease or phenomenon, over-regenerating peripheral nerves, over an area with circulatory compromise or peripheral vascular disease. Several precautions for the use of cryotherapy include hypertension, over the superficial main branch of a nerve, over an open wound, poor sensation or mentation, very young and very old patients. Adverse effects of cryotherapy. Various adverse effects have been reported when cold is applied incorrectly or when contraindicated. The most severe adverse effect is tissue death caused by prolonged vasoconstriction, ischemia, and thromboses in the smaller vessels. Excessive exposure to cold may cause temporary or permanent nerve damage, resulting in pain, numbness, tingling, hyperhidrosis, or abnormalities in nerve conduction. To avoid damaging soft tissue or nerves, cold should be applied for no longer than 45 minutes, and the tissue temperature should be maintained above 15 degrees Celsius. Methods of application. Cryotherapy may be applied using a variety of materials including cold or ice packs, ice cups, controlled cold compression units, vapocoolant sprays, frozen towels, ice water immersion, and contrast baths. Let's take a look at these types of cryotherapy. Cold packs or ice packs. Cold packs are usually filled with a gel composed of silica or a mixture of saline and gelatin and are usually covered with vinyl. The temperature of a cold pack is maintained by storing it in specialized cooling units or in a freezer at -5 degrees Celsius. Patients can use plastic bags of frozen vegetables or water at home as a substitute for cold packs. Cold packs and ice packs are applied in a similar manner, however. More insulation should be used to protect the skin when an ice pack is applied because it provides more aggressive cooling. For insulation, wrap the cold pack or ice pack in a towel. A damp towel is generally appropriate for a cold pack, whereas a dry towel should be used for an ice pack because ice provides more intense cooling. Leave the pack in place for 10 to 20 minutes to control pain, inflammation, or edema. If cryotherapy is being used to control spasticity, the pack should be left in place for up to 30 minutes. Ice massage. Ice cups or frozen water ice pops can be used to apply ice massage. Patients can easily make ice cups or ice pops for home use. For control of pain, inflammation, or edema, rub ice over the treatment area using small, overlapping circles. Continue ice massage application for 5 to 10 minutes, or until the patient experiences analgesia at the site of application. Controlled cold compression unit. Controlled cold compression units alternately pump cold water and air into a sleeve that is wrapped around a patient's limb. The water's temperature should be set at between 10 degrees Celsius and 25 degrees Celsius. Compression is applied by intermittently inflating the sleeve with air. Controlled cold compression units are most commonly used directly after surgery to control postoperative inflammation and edema. However, they may also be used to control inflammation and related edema in other circumstances. Vapocoolant sprays and brief icing. Vapocoolant sprays are used to achieve brief and rapid cutaneous cooling by evaporation before stretching. Rapid cutaneous cooling with a vapocoolant spray is generally used as a component of the approach known as spray and stretch to treat trigger points. For this application, immediately before the muscles are stretched, vapocoolant spray is applied in parallel strokes along the skin overlying the muscles with trigger points. Ice may also be stroked along the skin in the same area for this purpose. The distraction of rapid cutaneous cooling allows greater elongation of the muscle with passive stretching. Ice immersion. Usually used to treat the distal parts of the limb. The water tank is large enough to keep the limb filled with water and ice. The temperature varies from 13 to 18 degrees Celsius. Soak the parts to be treated for 10 to 20 minutes. Thank you for watching my video and hope you enjoy it.